This is Scott McDonald of DrDemographics.com. I want to thank you for viewing us. This will be the last of these sessions that we do before the end of the year. Now, every beginning of the year, what I like to do is to take a session and talk about that which is coming up demographically that you should know about. The trends that are happening, dangers that you should be aware of, opportunities that I think you should hear. And remember, we're taking this from the perspective of healthcare practices. There may be application for small businesses as well, but I want to make sure that doctors understand that we're looking out for their specific needs in this podcast. So where to put a practice, why to put a practice in a particular place, when might be the best opportunities, those are the topics we're going to talk about. Today, in this last episode, I'm going to talk about something that I consider to be potentially a great danger to healthcare practices that is revealed within the demographics. Now, I recognize I could be wrong because I'm kind of going out on a limb here. I'm going out on a limb because what I'm going to say is not necessarily a slam dunk. It hasn't happened yet. And some of you may not ever have this happen, but I have a feeling as far as the demographics and psychographics of the nation, this might be on the horizon. So I want you to be aware of it. But I'll acknowledge right off, I could be wrong, but I don't think I am. Right now, I think the greatest danger that you could have on the horizon for healthcare practices, and I'm talking about the kinds of practices that doctors own, not the kind of large conglomerates or hospitals, but rather for individual doctors. With that in mind, let me introduce the biggest danger, I think. It may be your staff. No, I don't actually think that staff is such a huge danger. Some people will say that if staff members embezzle or take profits or do something that might hurt the patients or make them think worse of the practice itself, that there's a danger and it could be something to be cautious about. But rather, this is a trend regarding staffing. So let me go ahead and share my screen and we'll take a look at some of those things. And I'm calling this the big threat to your practice, staff. Now, as I said, I don't necessarily think this is something that is going to be intentional, that staff would be negative in hurting your practice, but it is something nevertheless that I think is a potential danger, and it's not ubiquitous. It's not going to be everywhere, as I will explain. So just remember, Dr. Demographics is all about knowing where to move, start a practice or business, promote your efforts, and to get the most out of your location. I try to remember the trends that you're facing or are likely to face. So let's get into this. The biggest threat to your practice may not be too much competition. It may not be too few patients. I think that it may be a limited pool of practice staff that is on the horizon. And that is the demographic trend that I want to talk about. Some people are referring to this as a secret crisis. And let me explain why. It is, by the way, entirely possible that I'm misreading the data. I want to say that at the very, very beginning. It may not happen, and it may not happen to everybody. I may be worrying for no reason, but I'm seeing a trend forming that I want you to know about and to take proper precautions. I want you to heed the warning, not because I'm a demographer, but rather because I'm a college professor. And what I've been seeing are things that are happening to people in their late teens and early 20s that are potentially going to be affecting practices. Here's what I mean. It could be a secret crisis. Now, what do I mean by a secret crisis? Well, first of all, it is a demographic problem, a shift in the people who you are working with. And I say a secret crisis because unless something changes within your practice, you may not even notice it happening. In fact, I'm even going to suggest that there are doctors who may not actually feel the impact of this upon their own practices. So I think, on the other hand, that most of you will. I believe that the loss or absence of staff only becomes obvious, and in this way it's a secret, when a replacement is needed. So if you have a practice where everybody is stable and there's nothing really big and changing, you may not even notice it. On the other hand, I think if you're going to grow a practice, start a new practice, or make a major transition that might involve staff or administrative changes, this can be a big, big deal in the very near future. Here's what I mean. You've heard of this great resignation. Now, that's what trend the demographers are talking about, where a significant percentage of the labor force is leaving the workforce. Labor participation rates are dropping. Now, when everybody is starving to death, everybody's looking for work, and you may say, oh my gosh, we have so many people looking for work. But right now, the opposite is happening. We've had a lot of people who are leaving the workplace in order to do other things. It can be because of the government programs that pay people not to work, but it's also possible that there are other factors that are happening right now. Now, let me just go through a few things that are happening that I think are undeniable. And by the way, if you look up the Great Resignation on a Google search or something, a Yahoo search, more information is available on the reasoning. But here's the thing. We have lowering birth rates. Now, it takes a birth rate of 2.1 women being born, children being born per woman to keep a stable population. If there are more than 2.1 children born per woman, well, the population will increase. But right now in the United States, we're looking at an aggregate of about 1.7 births per woman. In some parts of the country, it is much lower, as I will illustrate. But with fewer births, that's affecting the general demographics of the United States. The job market for 20-somethings is extremely tight, meaning, in other words, it's hard to find 20-somethings to go to work. Now, a significant number of you who are running your own practices have hired 20-somethings, 22-year-olds, 28-year-olds, and they're the ones that are being especially difficult to hire because they're the ones who've left the workforce in greater numbers. The enrollment in 2-year community college programs is down. So let's say you're looking for a medical assistant, a dental assistant, low-trained, or people who do not have significant training in clerical duties. They're being very hard to hire. Now, we're seeing this in almost every community college or 2 to 4-year program in the United States. They're down. This happened at the university that I'm teaching in as well. And in talking to the administrators as to why, it's rather alarming how significant it is. In the last year, we lost about 3.2% of enrollment. And this isn't just at my university, it's across the board. But this is a trend that's been going on for about 2 years. So universities are seeing about a 6.5% lowering of people enrolling in college. That is commensurate with the number of people who are not looking for work right now. Now, there are many employment options that are available to these people who might otherwise be in the workforce, or in other words, the people who might be entry-level people to work in a medical or dental office. Optometric, veterinary, all these things are feeling the same pinch of employment. And from everything I can tell, it's going to get worse. It's something you should know about this population. They're in huge debt. Now, part of that debt came from consumer things. They bought a new car and they felt like they had to buy a new car. They had to buy some kind of a car. And those cars are far more expensive because of inflation. Many of them are living in apartments that have gone up dramatically in price. So they're living in conditions, they don't have as much disposable income. They've had to take on new roommates. Many of them are having to delay getting married. And so it's made it this lifestyle debt pretty significant. And I don't need to mention to you that educational debt has been going up. Now, in a recent episode, I talked about the debt that doctors are having when they're in school. And this has affected people who are thinking about getting into the professions, but also people who are trying to live and pay back those student loans. And it is being dramatically difficult. Now, by the way, at this writing, the federal government has decided to delay the forgiveness of student loan programs that President Biden recommended or said he was going to do. So they've delayed it from February to at least May, go beyond that. So this is putting even more pressure on the same things I'm talking about. Scholarship, in other words, how diligent these people are in schooling, is also going down. So if we talk about the average 20-something, they're reading at about a 6th grade level. It's not a criticism of them, but the educational system has rather failed these people, and they're not reading much, and they're not in training programs. That simply means their aspirations to go into a school or a learning program, a training of some kind, is at an all-time low. That's making it hard for people to come up to snuff, if you will, in educational programs that otherwise you might hire them from. The potential labor pool, in other words, the available pool of 20-somethings right now is untrained, ill-equipped, and unmotivated. Now everybody says, oh, we've got so many people on the border. Yeah, I mean, there are people who are dying to get into the country and they want to work. But the problem is their English skills are universally worse than they have been traditionally. They're not well educated, they're not reading, they're not well trained, and they're not prepared to enter the workforce. Now, it would be fine if there were agricultural workers who didn't necessarily have to be trained, but they're not. These are people who would like to do something else. So there's a mismatch between the people that are available, the labor pool, and what you in offices need. Now, this is an office administrator's wake-up call. Now, you may say, well, doctors, if you're the one who owns the practice, you got to know that. But let's be honest. Doctors depend on senior administrative people, an office manager, let's say, to hire and to train and to work with these new employees. And it's going to be hard for them. Let's understand this, that administrators may be great, but the labor pool that they're drawing on may not be. Now, the private practice profitability has been dependent upon low-wage workers for a very long time. We know that it's been traditional that you'll take people who are graduated from high school or initial training, and they will give them training and put them through a program. Now, you have to remember, these are not people who have been trained within the professions. They're usually not certified. So it's the entry-level employees that we're talking about, the low-wage young employees. And they've survived on having an entry-level salary that they're paying. But remember, these people are now being paid twice as much this year as they were even 2 years ago. And this makes them much less profitable for practices to survive. Now, other industries can resort to automation. So even hamburger flipper jobs can have an automatic hamburger flipper. And McDonald's is a good example of it. They actually have an automated thing that will cook the hamburgers for them and put them on a bun and get them all ready and wrap them. And they can do this at a much lower price than you can hire an entry-level person. But healthcare doesn't necessarily have automation that it can pick up on. Oh, sure, they may have the ability to enter patient information and billing. Yes, that automation is happening. But remember, this isn't a thing that is easily done, because if you're doing customer service, you're trying to help patients, in other words, you can't rely only upon automation to fill the gap when you don't have someone to do the work. Non-English speaking manual laborers can fill the gap, kind of. But you see, there's a disconnect when it comes to the healthcare industry. People need to speak English, and it matters a lot to them. Now, if a person who's older goes into an office and they themselves do not have a mastery of English, those older people who are usually English speakers are going to be frustrated and maybe even angry. It makes it more difficult to find people who can communicate well. Now, wages are going to have to be calibrated with skills, certifications, communications, and training. So in other words, as you're looking for a smaller group of people to draw upon, you have to pay them more in order to work in a healthcare environment than you traditionally were able to do. You can't just say, oh, well, I'll have the kid or the girl handle those lower level functions in the office that you've been depending on for so long. Now, there is a demographic and a geographic imperative that is at play here, and I want to go through that. English and communications, reading and writing skills are only going to grow in complexity and demand. But you see, the people who speak English and are good communicators are becoming fewer and fewer. The age cohort is not ubiquitous. So in other words, there are some places there are a lot more 20-somethings than there are in other places. Some states have a much better preparation for those skills that people have that would bring them into the healthcare environment. So there is that demographic component that I want you to be prepared for. So if you're trying to find where would be the best place to start up a practice, obviously you're going to want to say, well, where I can find a lot of patients, where there are very few competitors. Yeah, I got that. But you also have to remember the laborers, the people who work for you, that's going to matter a lot too. The target staff cannot afford to live, however, in places where they are most needed. Now, I'll take the example of a study that was done in San Jose, California. It was desired to find people who could be school teachers. They're educated and certified, but because the salaries, well, I should say the cost of living was so high, salaries couldn't keep up with the people who were there. So they had to pay a premium to get people who were entry-level elementary school teachers to come and work when there was huge demand. And this is a trend we've seen increasingly in many parts of the United States. The target staff can't afford to live in many of the places where they're most in demand. And this is going to be especially true in urban locations. Therefore, if they can't afford to live there, they have to have an even larger commute to get there. So is someone going to want to travel an hour, especially when fuel prices are high and rising, to get to an office where they might make a little more money than they were before? But it's going to be a tough, heavy lifting problem for the office to get good trained staff to be able to do that. Traditional practice models are unsustainable in many locations, and we're going to have to think out of the box. We're going to have alternatives. Now, I don't know what those alternatives will be. That's not the issue for this. I only am going to say you have to figure this out demographically and geographically in order to say this is a place that our practice, a large practice, can survive. It's not going to be easy to hire people and keep people to work in your practice for that reason. Patient demographics are, in fact, shifting. So the people you're trying to serve in terms of their age, their income, their education, housing, and the household size is in flux when compared to the people who you're trying to get to hire who will work in those locations that are desirable. Hey, you may have lots of new potential patients, but if you don't have people to work in the office, you have got a serious problem. Now, the answer for this is going to be the telephone consultation. We offer telephone consultations. They're not very expensive, but what we do is we'll get an idea of where you want to go and the particular situation that you want to work in. And we can say, these are the places that you will find where there are lots of 20-somethings or people who can work in your practice that will not cost you an arm and a leg. The best place is the telephone consult because we can start with a large number of places rather than have a formal demographic report that will be expensive and difficult for you if you have to look at several locations at one time. So the telephone consultation is an inexpensive way for us to discuss options for where you might want to go. Now let's talk about your best options for your future. Now stick with me for just a second. Many people got a divorce and they have children that are living outside the area and they still want to be their parent. Now this is not an issue of just where there are lots of patients and no competition. This may be an issue that is unique to you, and therefore we have to be a little more creative about giving you solutions. But it also happens you may be married to another professional. And we know the number of doctors who have married other doctors where you're trying to support two practices and two careers is heavy lifting. That's hard. So we may have to, again, talk on the phone about options that will work not just for one of you, but for both of you to take advantage of your education and your practice opportunities. If you would like to talk more, you can always write to me at info@drdemographics.com. or take a look at our reports, and I'm especially going to direct you toward a telephone consultation. This is Scott McDonald. Thank you for listening and watching, and I look forward to talking to you sometime in the future. I hope you have wonderful holidays and a happy new year.